You're at home alone, maybe watching TV or reading when suddenly your chest feels like it's in a vice. Your left arm goes heavy and numb, you're gasping for air and something deep inside you knows. You might be having a heart attack, and no one else is there. This nightmare scenario isn't rare. More than 380,000 Americans each year experience serious cardiac events while they're completely alone. And here's the part almost nobody talks about. A major study published in the European Heart Journal found that older adults who already knew what to do in the first 60 seconds of a heart attack increased their chances of survival by up to 73%. In other words, what you do in that first minute can literally decide whether you live or die. But here's the truly frightening part. The same research showed that around 9 out of 10 people over 60 have no clear idea what the right steps are when they're alone during a cardiac emergency. They panic, they freeze, or they try things they saw on the internet that actually make things worse. So today we're going to walk through 7 evidence-based strategies that may help keep you alive long enough for professionals to take over if you ever face this situation alone. These are not old wives' tales or random social media hacks. They're based on guidance from cardiologists and emergency medicine specialists at leading institutions like Johns Hopkins and the Mayo Clinic. And wait until you hear the number 1 tip. A study from Harvard-affiliated researchers found that one specific action, when done properly, can give you a survival advantage similar to having a trained paramedic in the room with you. It has nothing to do with aspirin alone, and it's so important that emergency dispatchers are increasingly being trained to coach people through it over the phone. Before we dive in, let us know in the comments. How old are you, and where are you watching from? We really do read the comments and try to respond, so introduce yourself below. Alright, let's get started. Number 7. Build your emergency communication system now. We'll start with something that sounds simple, but becomes absolutely critical when seconds matter. Having a real emergency communication system is much more than just keeping your phone nearby. It needs to be designed around what actually happens to your body and brain during a heart attack. When your heart and circulation begin to fail, your brain starts losing oxygen almost immediately. Within 15 seconds, many people experience confusion, foggy thinking, or even temporary inability to move properly. A study in the Journal of Emergency Medicine that followed heart attack survivors over 60 found that about 2/3 of them struggled to remember basic information like their own address when calling 911, not because they had dementia, but because of oxygen deprivation. So here's what to put in place before anything happens. Write down your full address, including apartment number, building name, and any gate codes, on a bright card. Tape it next to every phone and somewhere visible near your main entrance. Add your phone number and any special instructions like use side gate or back entrance. Program 911 or your local emergency number as speed dials tone, one on every phone, including your cell. When your hands are shaking, pressing one button is much easier than hunting for 3 separate digits. Keep your phone charged and within reach, especially at night. Many fatal events happen between late night and early morning when phones are left in another room. If you live alone, strongly consider a medical alert device, and the important part, wear it consistently, even during sleep and showering, if it's waterproof. Let trusted neighbors know if you have heart issues. Give one a spare key and ask them to check if they hear something unusual or don't see your usual activity. In an apartment building, inform the manager, concierge, or doorman that you have a cardiac condition so they know to act quickly if emergency services arrive. This communication system sounds basic, but when your brain isn't working at full power, these simple preparations can literally save minutes and your life. Number 6. The truth about cough CPR. You may have heard about something called cough CPR, the idea that forcefully coughing during certain heart rhythm problems can help keep you conscious for a short time. Some small hospital studies under carefully monitored conditions suggested that repeated strong coughs might help certain patients maintain blood flow for a little longer when their heart rhythm becomes dangerously abnormal. But here's what's crucial to understand. Major heart organizations do not recommend using cough CPR as a self-rescue technique at home. Why? It only applies to very specific heart rhythm issues detected on a monitor. It can give people a false sense of security, leading them to delay calling 911. Trying to remember and perform a forceful cough pattern while panicking can actually make you more short of breath. So instead of treating cough CPR like a magic trick, think of it as a myth you might see online, not a first-line emergency strategy. Your number 1 priority should always be, call emergency services immediately and follow the instructions of the dispatcher. If your cardiologist ever gives you personalized instructions about coughing or specific maneuvers, follow their plan, not something from a video. We included this point because many seniors have heard about cough CPR and wonder if they should rely on it. The short answer: don't depend on it. Call for help first. If this video has been helpful so far, tap the like button so more seniors can discover it. YouTube shows this kind of content to more people when you engage, and don't forget to subscribe for more daily senior health tips. Number 5. The aspirin strategy. Done the right way. Almost everyone has heard that aspirin can help during a heart attack. What most people don't realize is that how you take it can affect how quickly it starts working. Aspirin helps by making your blood less sticky, which can slow the growth of a clot inside a coronary artery and sometimes help blood move past a partial blockage. Large clinical studies have shown that taking aspirin early during a confirmed heart attack can reduce the risk of death. But there are two big points many people miss. You should only use aspirin in an emergency if your doctor has told you it's safe for you. Some people should avoid it due to allergies, bleeding risks, stomach issues, or other medications. When your doctor says it's appropriate, they often recommend chewing the tablet rather than swallowing it whole, because chewing breaks it down faster. It can start being absorbed through the lining of your mouth instead of waiting to dissolve in your stomach. A few practical tips to prepare, always based on your doctor's advice. RNs: ask your doctor, if I ever think I'm having a heart attack, do you want me to take aspirin? If yes, how much and in what form? Keep the recommended dose and type of aspirin in places you can easily reach: your nightstand, kitchen, purse, or wallet. Check the expiration dates every few months and replace older bottles. Store aspirin in its original container to protect it from moisture. And remember, aspirin is not a substitute for emergency care. Even if you take it, you still need to call 911 or your local emergency number right away. Number 4. Use the cardiac position. How you position your body when you're having chest pain or other heart attack symptoms can influence blood flow and breathing. Experts often recommend a variation of what's called the semi-Fowler's position during certain cardiac events, as long as you're still conscious and able to move. Here's what it usually looks like. RONTS: don't lie completely flat unless you're about to pass out. Instead, sit at about a 45-degree angle, propped up with pillows, a headboard, or a wall. Bend your knees if you can, with your feet flat. This position can reduce the workload on your heart, make it easier to breathe by giving your lungs and diaphragm more room, help prevent fluid from backing up in your lungs. If you start to feel faint or like you might collapse, carefully lower yourself to the floor. Don't just drop. If you lose consciousness or feel extremely weak, the recovery position on your side with one knee bent is often safer than lying flat on your back, because it helps keep your airway open, reduces the risk of choking if you vomit. A few extra details: loosen tight clothing, belts, collars, ties, scarves, anything that restricts breathing. Keep the room cool but comfortable. If you're sweating heavily, avoid piling on blankets that force your heart to work harder to cool you down. If you can open a window without overexerting yourself, do it for some fresh air, but don't go outside alone where you might collapse unseen. Again, these steps are about buying time and comfort while you're waiting for help, not treating the heart attack itself. Number 3. Controlled breathing to calm your heart. When chest pain hits and fear kicks in, most people start breathing too fast and too shallow. This panic breathing can lower the amount of oxygen reaching your heart and brain and make symptoms feel even worse. A simple technique called paced diaphragmatic breathing can help calm your nervous system and reduce strain on your heart while you wait for help. Here's a safe, general pattern you can practice when you're well, so it's easier to use during stress. Breathe in slowly through your nose for a count of 4, letting your belly rise. Gently hold your breath for a count of 4. Breathe out slowly through pursed lips as if blowing out candles for a count of 6. A few important points. Place one hand on your chest and one on your abdomen. The belly hand should move more. That tells you you're using your diaphragm. The longer exhale helps activate the part of your nervous system that slows your heart rate and relaxes your blood vessels. Practicing this for just a few minutes daily can make it feel more natural if you're ever in an emergency. This breathing technique helps prevent hyperventilation, can slightly lower heart rate and blood pressure, reduces anxiety while you wait for paramedics. It does not replace medication, CPR, or emergency treatment, but it may help your body cope better in those critical minutes. Number 2, the door unlock and signal protocol. This one sounds so simple it's easy to overlook, but it has a huge impact on survival. Paramedics can't help you if they can't reach you. In many real-life cases, emergency teams arrive quickly but lose precious minutes because they have to break down doors or search for the right apartment. So if you think you might be having a heart attack and you're still able to move, call emergency services immediately. As soon as you safely can, unlock your front door. If possible, leave it slightly open so responders can enter quickly. Turn on as many lights as you can so your home stands out, especially at night. In apartments or multi-unit buildings, call the front desk, security, or building manager after you've called 911. Tell them you've called an ambulance and ask them to meet the paramedics and guide them to your unit. Planning ahead can help even more. Install a lockbox with a spare key outside and share the code with trusted family or your local fire department. Many areas allow you to register it. Keep a medical information sheet taped inside your front door at eye level, name and date of birth, medications and doses, allergies, diagnosis, e.g. coronary artery disease, diabetes. Consider smart locks if you can afford them. Some systems allow you or a trusted person to unlock your door from a phone. The goal: once paramedics arrive on your street, it should take them seconds, not long minutes, to reach you. Number 1. Use nitroglycerin safely and correctly, with your doctor's plan. Now for the most powerful tip, and the one that absolutely must be done under medical guidance. Studies have shown that when certain patients use nitroglycerin appropriately and quickly at the very start of a cardiac event, their outcomes can be significantly better, sometimes approaching those who receive very rapid emergency care. Nitroglycerin works by relaxing and widening blood vessels, reducing the workload on your heart, improving blood flow through partially narrowed arteries. But here's what's critical. Nitroglycerin is a prescription medication and must only be used exactly as your doctor instructs. If you're over 60 or have risk factors like high blood pressure, diabetes, high cholesterol, or a strong family history of heart disease, talk to your doctor and ask, should I carry emergency nitroglycerin? If yes, exactly when and how do you want me to take it? How does it fit with any other medications I'm on, like blood thinners or medicines for erectile dysfunction? General principles doctors often emphasize: 1. Sit or lie down before taking nitroglycerin, because it can lower your blood pressure and make you dizzy. The medication is usually placed under the tongue to dissolve. It's designed to be absorbed quickly there. Never take more than your doctor has instructed. If your symptoms are severe, sudden, or not improving, call emergency services right away. Don't just keep taking tablets and waiting. Important safety warning: certain medications, like some drugs for erectile dysfunction, can be dangerous when combined with nitroglycerin because they can cause a catastrophic drop in blood pressure. Your doctor should explain any combinations you must avoid and how long to wait between them. Nitroglycerin is sensitive to heat, light, and air, so keep it in its original bottle and replace it regularly, as your doctor advises. Again, the key idea is not to self-design a protocol, but to have a clear, written plan from your cardiologist or primary care doctor, and to keep your medication easily accessible. Final, crucial reminder: these 7 strategies are meant to prepare you, calm you, and help you make the best possible use of the minutes before professionals arrive. They do not replace emergency medical care. At the first sign of heart attack symptoms, chest pressure, pain spreading to the arm, jaw, back, sudden shortness of breath, unexplained sweating, nausea, or a feeling of impending doom, call 911 or your local emergency number immediately. Practice the breathing technique now. Set up your emergency information. Talk to your doctor about aspirin and nitroglycerin, and make sure your home is easy to access in an emergency. Print out a simple checklist and keep it somewhere visible so you don't have to rely on memory during a crisis. Heart disease remains the leading cause of death for older adults, but preparation and knowledge can tilt the odds in your favor. Now we'd love to hear from you. Have you or someone you care about ever gone through a heart emergency while alone? What is one thing you wish you'd known beforehand? Share your experience in the comments. Your story might be the lesson that saves another life.